So, ladies and gentlemen, panoramic X-rays allow the dentist to view the entire dentition and related structures on a single image. Né? So, the things that we'd expect to see is the entire dentition, the nasal and the orbital areas, the alveolar bone, carious lesions, especially if it's moderate to severe, and then we'll expect to see things such as fractures, cysts, as well as tumors. In the past, panoramic images were not recommended for diagnosing dental caries. This is still relevant. We do prefer periapicals as opposed to panoramic images, as well as in terms of just avoiding an unnecessarily excessive dose of radiation to the patient, okay? Or periodontal disease, lesions, and lesions because of overlapping of posterior contact areas. So essentially, ladies and gentlemen, the problem or what happens with panoramic x-rays is that they are an x-ray that extends from the condyle on the one side of the patient's head to the condyle on the other side. So this essentially results in overlapping and a loss of detail, but the panoramic radiographs are valuable when we need to assess the patient overall, as in especially with the extraoral or the facial structures of the patient. So panoramic x-rays can be taken on adults, children, edentulous patients, patients who have trismus, so those that are unable to open their mouths very wide, as well as useful in patients that are in wheelchairs. So the next slide just shows you guys the structures that are seen or that we expect to see on a panoramic image. This is very, very, very important. That's why I kept saying correlate your anatomy that you have learnt before with the anatomy that you would expect to see on a radiograph. I think if you try and correlate or combine the two, it will make it very, very easy for you guys to identify a lot of structures that you would expect to see on a panoramic image. So, ladies and gentlemen, there are two types of panoramic machines that are currently available on the market. That is the film-based panoramic machine, as well as the direct digital imaging panoramic machine. So essentially, the main difference between the direct digital and the film-based one is the image receptor, okay? Because digital units basically use a sensor array as opposed to a film, and then the image is produced immediately on the computer monitor rather than on film after processing. Because basically in a film-based one, you'd have to take the panoramic image and then take it to the back so that it can be processed, making use of a special processing machine that requires you as the dental assistant to basically monitor the two types of solutions, being the developer solution as well as the fixer, okay? So then above all of that, the main similarity between the two is that with both of them, the film-based and the digital unit, that is, the film holder, also known as the cassette, and the x-ray head rotate opposite each other around the patient's head. This is because they are connected by bars extending from the top of the machines, and they tend to rotate at the same speed. So as a result, then we find that the x-ray essentially extends from one condyle to the other, as I had mentioned before, and this may cause a bit of overlap and a loss of detail, but it is great when we want to assess all the other extraoral details as opposed to the more minute details that we can maybe achieve with a periapical x-ray. So this is an example of a film-based panoramic unit. With this unit, ladies and gentlemen, they are constantly being updated and improved. From 5 years ago versus today, a lot of improvements have been made, but some things still fundamentally stay the same, ladies and gentlemen. So they differ essentially, these units, by size and the shape of the focal trough, the number and the location of the rotational centers, and the type of cassette holder that can be used for the x-ray film. All units, however, ladies and gentlemen, include the basic following components. So this will always be the same, be it a film panoramic unit or a digital panoramic unit. For both of them, we expect to find 1, exposure controls, 2, a head positioner, 3, an x-ray tube head, and then 4, and most importantly, being our cassette holder. With this unit, ladies and gentlemen, they are constantly being updated and improved. From 5 years ago versus today, a lot of improvements have been made, but some things still fundamentally stay the same, ladies and gentlemen. So they differ essentially, these units, by size and the shape of the focal trough, the number and the location of the rotational centers, and the type of cassette holder that can be used for the x-ray film. All units, however, ladies and gentlemen, include the basic following components. So this will always be the same, be it a film panoramic unit or a digital panoramic unit. For both of them, we expect to find 1, exposure controls, 2, a head positioner, 3, an x-ray tube head, and then 4, and most importantly, being our cassette holder. So as you can see, the four basic components of a panoramic unit are still basically found even on the digital version of this equipment, being the exposure controls, being the head positioner, our X-ray tube head, and then from there being the cassette holder. So nothing essentially changes. It's just that obviously technology just gets better, sharper, and has better resolution as the years go by. So with this picture, or on this slide, ladies and gentlemen, it is just showing you what I had already discussed earlier on with you guys, that the tube head moves around the patient's head. So that's how we get an image that basically is apparent from one condyle to the other condyle, né? And then essentially having those two that I had discussed earlier on moving about at the same speed in opposite directions, okay? So that's essentially what is being portrayed or visualized to you with this particular slide. So the next thing, ladies and gentlemen, that we'll be discussing that is very important and you must take into consideration every time you take a radiograph, in particular extraoral radiographs, is the focal trough. So the focal trough, ladies and gentlemen, if I can put it this way, it is basically known as the image layer or sharpness. Ne? So this would be a three-dimensional curved zone in which the dental arcs are positioned to achieve the sharpest image. Ne? So like I said before, the 3D or the curved zone in which the dental arcs are positioned to achieve the sharpest image. So a focal trough, it is an imaginary 3D curved zone, and it appears in which structures appear clearly on a panoramic radiographs, okay? So basically, when a patient's jaws are positioned within this zone, being the focal trough, it basically results in a radiograph that is reasonably clear and well-defined. Okay, if the jaws are positioned outside of this zone, we can expect images that appear blurred or indistinct. So we have to always take that into consideration when taking panoramic radiographs. So what I also need you guys to be aware of is that the size and the shape of this focal trough will vary from one manufacturer to another. So hence, I started off this extra oral technique or images by showing you guys the Sirona pamphlet. So it is very important that every time a piece of equipment comes into the practice, you actually read the manufacturer's instructions. The same applies to panoramic units. Read the manufacturer's instructions, understand where that focal trough is so that you can make sure that you can practice it, implement it, and give resultant sharp images to your dentist at all times. So it's very, very important to read. Ne? So essentially, the quality of the radiograph depends on how the patient's jaws are positioned within this trough that is determined by the manufacturer, as it's their piece of equipment, and then how closely the patient's jaws conform to this focal trough. So this is just a representation on this slide of an imaginary focal trough that will be useful, or you will identify and read up on based on the booklet that you would have received from your manufacturer. Okay, so then from there, like I told you guys, I had mentioned before, there are four basics that remain the same, be it a digital or a film-based panoramic unit. So these are the four basic equipment or components of your unit that will expect to find regardless of the type of panoramic unit that you are using.